I'm Liz, and this is my case study presentation. My basic patient data, we have a 77-year-old female who weighs 115 pounds and is 60 inches tall. So this patient is ranked in the does not participate in regular exercise category, and in the signs and symptoms suggestive of cardiovascular disease, metabolic, or renal disease, regardless of disease status. The patient does not meet the requirement for exercise participation, although she participates in moderate physical activity 3 days a week. She only exercises for 20 minutes at a time and has only been doing it for 2 months. The patient is symptomatic with shortness of breath at rest, orthomild exertion, orthopnea, palpitations or tachycardia, known heart murmur, and unusual fatigue or shortness of breath with usual activities, so she would be put in the far right category. Although the patient has known cardiovascular disease, she was put into this category due to her symptoms alone. If she was asymptomatic but still had a cardiovascular, renal, or metabolic disease, then she would be put into the middle category. But due to her symptoms, she's in the far right category. And again, because she does not meet the 3 days a week for at least 30 minutes for a 6-month period, or the last 3 months, then she does not participate regularly in exercise. So we're moving on to the risk factors. The patient, her age is a risk factor because she is greater than 55 years of age as a female. She is 77. Family history is a risk factor for this patient because she had a myocardial infarction, coronary vascularization, or sudden death before the age of 55 years in a first-degree male relative or 65 years in a first-degree female relative. Cigarette smoking is not a risk factor for this patient because she is not a current smoker, has not quit cigarette smoking within the last 6 months, or been exposed to environmental tobacco smoke. Physical inactivity is a risk factor for the patient. She exercises 20 minutes at a time, 3 times a week, which is only a total of 60 minutes of moderate exercise per week. And in order to meet the physical activity requirements, she would need to exercise 75 to 150 minutes with moderate to vigorous activity per week. So because she does not meet this requirement, physical inactivity is a risk for her. Body mass index and waist circumference, or obesity. The patient is not at risk for this because her calculated BMI is 22.4, which is less than 30. Her blood pressure is a risk factor. Her systolic blood pressure is greater than 130 at 132, and her diastolic blood pressure is also greater than 80, which at 84. She's also taking hypertension medication, so regardless of her measured blood pressure, her blood pressure is at risk. Lipids, she is at risk because her LDL is greater than 130 milligrams at 265 milligrams. Even though we are given LDL and HDL, LDL is prioritized for this category. Blood glucose is also a risk factor. Patient's fasting blood glucose is unknown, so we need to assume that this is a risk factor. And then our negative risk factor, HDL, not a risk factor for her. Her HDL is 33 milligrams, which is less than 60, so we cannot count it as a risk factor. That would subtract from her total risk factors. So this patient has a total of 6 risk factors. Again, kind of just summary. She's older than 55. She has a family history of myocardial infarction, coronary vascularization, or sudden death before the age of 55 years in a first female relative, or 65 years in a first-degree female relative. She is physically inactive due to the fact that she exercises for less than 75 to 150 minutes of moderate exercise per week. Her blood pressure is a risk factor because she's on blood pressure medication. She also has a measured blood pressure that's elevated. Her LDL is greater than 130 milligrams, and her blood glucose is unknown. So those are the 6 risk factors. Moving on to the testing and measures. The patient's BMI was calculated to be 22.4. This puts her in the category or the ranking of normal, which is between 18.5 and 24.9. 22.4 falls into that category. The patient's percent fat was 17.7%, which, according to her age of 77, it puts her between 18.8% fat and 16.4% fat. So going off that, it would 17.7 falls between those two. So we would slide over and you go to the lowest ranking, or the lowest value. So her percent fat is greater than 18, less than 18.8, but greater than 16.4. So we go to the lower ranking. So she would be 90th percentile and in the excellent category. Cardiorespiratory fitness. Her value was 21.8 for her VO2 max. That falls between 21.2 and 22.0, but because it is not equal to 22.0, we go down to 21.2, which is 60th percentile, and it's a good ranking. Grip strength. I believe this patient had one of her hands was 16 and one of her hands was 17, so we would take the best score, which is a 17. So 17 falls between 16 and 19. You go to the lowest of the two scores on the table. So you go to 16, she's 77, and that would put her in the 10th percentile. Upper body strength. The patient was able to do a 1 rep max of bench press with 45 pounds. So her bench press weight ratio, as seen calculated above, is 0.39. Again, she's a female and she's older than 60, so we go to the far right category or column on the table. And 0.39 is actually an exact value on the table, so you follow it over. It's in the poor category at 25th percentile. And then lower body strength. Again, this is a ratio which was calculated out to be 0.87. On the table, if you go to woman, 60 and above, because again, the patient is 77, 0.87 falls between 0.85 and 0.88. We go to the lowest of the two, which is 0.85. You would see that the patient is well below average at the 20th percentile. And then I believe this is the last one, push-ups. The patient was only able to complete 3 push-ups, so going to the 60 to 69 age bracket, because that's the closest age available for the patient. We go to the woman's column, and because she did 3, it falls between 2 and 4, 2 to 4 the range. So then you follow that over, and the patient's category was fair. Health concerns and low performing fitness tests. Again, just kind of a summary. The patient had 6 risk factors, which were age, family history, physical inactivity, blood pressure, lipids, and blood glucose. And then in terms of her fitness test, she had 3 low performing fitness tests. The upper body strength, she only scored 25th percentile and had poor ranking. Her lower body strength, she had only 20th percentile and well below average ranking. And her grip strength only met the 10th percentile. I believe in class we discussed how 40th percentile is about where the patient should be at minimum before you have to start worrying about their performance. So again, that's why these are low performing fitness tests, because they are all below the 40th percentile and they're all below the fair ranking.